entrance to the massive open online course on Indian economy. After completing the module, you will be able to understand the importance of national health policy. You will be knowing the different principles and major objectives of national health policy which has been undertaken time to time during 1983, then in 2002 and then in 2017. Also, you will be identifying the health status and program impact in India. And finally, you will get to know about the national policy for rare diseases undertaken in 2021. Now, first, in this module, we will be discussing the introductory part. Then we will move to the national health policies during 1983, 2002 and in 2017. First, we will discuss the National Health Policy 1983, then we will go to National Health Policy 2002 and then we will discuss the National Health Policy 2017. I will also discuss the different goals, principles and objectives of National Health Policy 2017. Then I will discuss the progress achieved under universal health coverage, and then the specific quantitative goals and objectives will be discussed. In the third topic, we will be discussing the national policy for rare diseases undertaken in 2021, and finally we will wrap up the module considering some conclusive remarks. The National Health Policy is basically an initiative by the central government to strengthen the health system in India. This initiative molds various dimensions of health sectors like disease prevention, promotion of good health via cross-sectional actions, health investment, strengthening human resources, technological advancements, and many more. The National Health Policy was endorsed by the Parliament of India in 1983 and have been updated in 2002, and then again it has been updated in 2017. Now I will discuss the NHP National Health Policy 1983. India has its first national health policy in 1983, that is 36 years after independence. The Ministry of Health and Family Welfare, Government of India announced a national health policy in 1983, and the policy focuses on the need of establishing comprehensive primary healthcare services to reach the population, especially in the remote area of the country. Then I am coming to the National Health Policy 2002. This policy in 2002 is basically a revised health policy for achieving better health care, and unmet goals has been brought out by the Government of India. The government and the health professionals are obligated to provide good health care to the society. And through this policy, health service to a larger group is to be provided, rather a smaller group is basically one of the major objectives. Now I will come to National Health Policy 2017. The National Health Policy undertaken during 1983 and 2002 have served well in guiding the approach for the health sector in the 5-year plans. But 14 years after the last health policy, that is after the NHP 2002, the context has changed in mainly 4 major ways. The first is the growing burden of non-communicable diseases. Second is the emergence of the robust healthcare industry. Third one is the growing incidences of unsustainable expenditure due to healthcare costs. And finally, the rising economic growth enabling enhanced fiscal capacity. In practice, however, the private healthcare sector is responsible for the majority of healthcare in India, and a lot of healthcare expenses are paid directly out of pocket by the patients and their families rather than through health insurance due to incomplete coverage. The government health policy has thus far largely encouraged private sector expansion in conjunction with well-designed but limited public health programs. The primary aim of the National Health Policy 2017 is to inform, clarify, strengthen and prioritize the role of the government in shaping health systems in all its dimensions, like investments in health, organization of healthcare services, prevention of diseases, and finally, the promotion of good health through cross-sectoral actions and access to technologies. Developing human resources, encouraging medical pluralism, building knowledge base, developing better financial protection strategies, strengthening regulation and health assurance are other strategies of National Health Policy 2017. Now, I am coming to the key policy principles of NHP 2017. First one is the professionalism, integrity and ethics. The health policy commits itself to the highest professional standards, integrity and ethics to be maintained in the entire system of healthcare delivery in the country. Next one is equity. Reducing inequity would mean affirmative action to reach the poorest. Third one is the affordability. As costs of care increases, affordability as distinct from equity requires more emphasis. Next point is the universality. Prevention of exclusions on social, economic or on grounds of current health status is another important principle. The next principle is patient-centered and quality of care. Gender-sensitive, effective, safe and convenient healthcare services to be provided with dignity and confidentiality. The next point is accountability. Financial and performance accountability, transparency in decision making and elimination of corruption in healthcare systems both in public as well as in private. The next principle is inclusive partnerships. A multi-stakeholder approach with partnership and participation of all non-health ministries and communities is very much required. Next point is pluralism. Patients who so choose and when appropriate would have access to Ayush care providers based on documented and validated local, home and community-based practices. Next point is decentralization. Decentralization of decision making to a level as is consistent with practical considerations and institutional capacity. Then comes dynamism and adaptiveness. Constantly improving dynamic organization of healthcare based on new knowledge is very much needed. Now, I will discuss the different objectives of NHP 2017. The major objectives are to achieve progressive universal health coverage, to reinforce trust in public healthcare system, and to align the growth of private healthcare sector with public health goals. Now come to the specific quantitative goals and objectives of NHP 2017. The indicative quantitative goals and objectives to achieve sustainable development in healthcare sector are outlined under three broad components like health status and program impact, health systems performance and health systems strengthening. First, I will discuss the health status and program impact. Under it, different points can be mentioned like life expectancy and healthy life. There are several points that comes under life expectancy and healthy life, like increased life expectancy at birth from 67.5 to 70 by 2025. To establish regular tracking of disability adjusted life years index as a measure of burden of disease and its trends by major categories by 2022. To reduce TFR to 2.1 at national and subnational level by 2025. Next comes the health status and program impact. Under it, so many points can be mentioned like mortality by age and or cause. Reduce under 5 mortality to 23 by 2025 and MMR from current levels to 100 by 2020. To reduce infant mortality to 28 by 2019 and to reduce neonatal mortality to 16 and stillbirth rate to single digit by 2025. The next point is reduction of disease prevalence or incidence. Another important focus or objective of NHP 2017 is to achieve global target of 2020, which is also termed as target of 90:90:90 for the HIV or AIDS patients. That is, 90% of all people living with HIV know their HIV status, and out of them 90% of all people diagnosed with HIV infection receive sustained antiretroviral therapy, and 90% of all people who are receiving the therapy, that is the antiretroviral therapy, will have viral suppression. So this is one of the major objective of NHP 2017. The other objectives are to achieve and maintain elimination status of leprosy by 2018, Kala Bazar disease by 2017 and lymphatic filariasis pockets in endemic pockets by 2017. Finally, the objective to achieve and maintain a cure rate of more than 85% in new sputum positive patients for TB and to reduce incidence of new cases to reach elimination status by 2025. Other objectives may include reduction of the prevalence of blindness to 0.25 out of 1,000 by 2025 and to reduce the disease burden by 1/3 from the current levels which is prevailing in the Indian sector, specifically in the Indian health sector, and to reduce premature mortality from cardiovascular diseases, cancer, diabetes or chronic respiratory diseases by 25% by 2025. Now come to the health systems performance. Under it, different points can be mentioned. The first point is the coverage of health services. Under it comes the increase in the utilization of public health facilities by 50% from current levels by 2025. Then comes the antenatal care coverage to be sustained above 90% and skilled attendance at birth above 90% by 2025. More than 90% of the newborn are to be fully immunized by 1 year of age by 2025, and to meet the need of family planning above 90% at national and subnational level by 2025. Now come to the cross-sectoral goals related to health. Under it also so many points can be mentioned, so many aspects can be covered, like relative reduction in prevalence of current tobacco use by 15% by 2020 and 30% by 2025. Another important point is the reduction of 40% in prevalence of stunting of under 5 children by 2025. And then come to the access to safe water and sanitation for all by 2020, that is Swachh Bharat mission. Then come to the reduction of occupational injury by half from current levels of 334 per lakh agricultural workers by 2020. Now under health systems strengthening, the health finance aspect should be mentioned, which is another major part, because without financing the health policies cannot be undertaken. So health finance should require special mention. So many points, so many characteristics can be mentioned under health finance, like increase in the health expenditure by the government as percentage of GDP from the existing 1.15 to 2.5% by 2025. Then increase in the state sector health spending to more than 8% of their budget by 2020. Then to reduce the proportion of households facing catastrophic health expenditure from the current levels by 25% by 2025. Now under health system strengthening, the health infrastructure as well as the human resource can also be mentioned. Under it, we can discuss the ensuring of availability of paramedics and doctors as per Indian Public Health Standard norm in high priority districts by 2020. Then to increase the community health volunteers to population ratio as per IPHS norm in high priority districts by 2025. And also to establish the different primary and secondary care facility as per norms in high priority districts, that is population as well as time to reach norms by 2025. Now I will discuss the health management information, that is the different information or data that we can collect on health management. So many points can be mentioned under this head, like to ensure district level electronic database of information on health system components by 2020. The other points can be to strengthen the health surveillance system and establish registries for diseases of public health importance by 2020. Also, to establish the federated integrated health information architecture, health information exchanges and national health information network by 2025. There can be so many coordination between the doctors and the patients or the different clinics. So that is very important, the networking on the part of the doctor and the patient as well as the clinical people who are associated with the health protection should be maintained. Now I will come to the national policy for rare diseases, which has been undertaken in 2021. Now we are all aware of the fact that the Ministry of Health and Family Welfare, Government of India, formulated a national policy for treatment of rare diseases. We call it NPTRD. So the Government of India has formulated the policy in July 2017. The implementation of the policy, however, faced certain challenges. So in front of the so many challenges, the national policy for rare diseases has been undertaken. And a limiting factor in its implementation was bringing states on board and lack of clarity on how much government could support in terms of tertiary care. The World Health Organization, WHO, defines rare disease as often debilitating, lifelong disease or disorder with a prevalence of 1 or less per thousand population. But the problem lies in the definition of rare diseases. Different countries have used different definition to explain rare diseases. There is no common definition, there is no specific definition of rare diseases. So this is another limiting factor or challenge before the national policy for rare diseases in 2021. As I just told you that different countries have their own definitions, have their own clarification to suit their specific requirements and in the context of their own population, how to define the rare diseases. The healthcare system and resources are to be undertaken based on the definition. So different countries, as they are defining the rare disease differently, so this is basically a challenging factor before the national policy for rare diseases. The use of varying definitions and the diverse terminology in explaining the rare disease can result in confusion and inconsistencies and has a wide implications for access to treatment and for research and development. Next comes the challenges in treatment related to rare diseases. The different challenges can be broadly classified under two heads. One is the unavailability of treatment, another is the prohibitive cost of treatment. The unavailability of treatment is related to the medicines, that is the availability and access to medicines are important to reduce morbidity and mortality associated with rare diseases. But since the diseases are very rare, so access to medicine is also rare. The next problem is related to prohibitive cost of treatment. As the number of persons suffering from individual rare diseases is small, they do not constitute a significant market for drug manufacturers to develop and bring to market drugs for them. For this reason, the rare diseases are also called orphan diseases, and the drugs to treat them are called orphan drugs. Now come to the Indian scenario, that is the Indian economy, what situation it is facing in the context of the rare diseases. What is the actual picture of the Indian economy in terms of rare diseases? Several points can be mentioned under this Indian scenario, like the data on how many people suffer from rare diseases or the different rare diseases that are considered rare globally. It is practically lacking in India. In the global context, we can have data on how many persons are suffering from rare diseases, but this type of data, that is how many patients are suffering from rare diseases in India, is practically lacking. So you can easily understand that the problem is very severe. If you don't have the exact idea of the number of persons affected from rare disease, then the treatment connected with these patients is also very, very difficult. The second point that can be mentioned is the lack of epidemiological data on incidence and prevalence of rare diseases, which impedes understanding of the extent of the burden of rare diseases and development of a definition. That is the definition problem. That is, different countries are defining rare diseases in different ways and there is no specific definition. So that creates confusion from the part of understanding and clarity. Another problem is the hampering of the efforts to arrive at correct estimation of the number of persons suffering from these diseases and describe their associated morbidity and mortality. That is, how many persons are actually suffering from these diseases, that is also not very much clear in the Indian context, which is clear in the global context but not in the context of India. Another problem is the economic burden of most rare diseases is unknown and cannot be adequately estimated from the existing data sets, because you know that you have already learned that the data set does not give proper information about the number of affected persons, and if the number of affected persons cannot be estimated properly, then the expenditure incurring on those diseases cannot be calculated. Although extremely challenging considering the complexity of various diseases and difficulty in diagnosis, there is a clear need to undertake systematic epidemiological studies to ascertain the number of people suffering from rare diseases in India. So, as this is not clear, as the number of persons affected in rare disease is not very clear, but this estimation, a proper estimation or calculation of the number of people affected from rare disease should be done. This is very much needed for proper treatment of the rare disease patients. So far, only limited number of diseases has been recorded in India from tertiary care hospitals that are globally considered as rare diseases, though ambit may encompass from 7,000 to 8,000 disorders only. Now come to the conclusive part. To wrap up the whatever we have learnt in this module, it can be mentioned that public health is a vital function that requires broad public concern and support in order to fulfill society's interest in assuring the conditions in which people can be healthy. Another important point is the organized community effort, which is very much required to prevent disease and to promote health, is both valuable and effective, so that we can enjoy a healthy life. Another important point that should be mentioned is the restoring an effective public health system, which cannot be achieved by public health professionals alone, but a deliberate action is very much necessary. Another point, or the final point that should be mentioned, is the specific actions appropriate to strengthen public health will vary from area to area. So, the action or the strategies that are to be undertaken by the public health sector is not at all uniform. It will vary from one state to another or from one area to another, and we must blend professional knowledge with community values to lead a healthy life. Thank you.